So, Mr. Robinson, it's now 1 month, I think, right, from the time that
Yeah.
we did the injection. And I actually saw Mr. Robinson back at about 2 weeks following the manipulation. He had a very tiny little skin split right there, which is healed in beautifully, as they all do. And one of my concerns initially was that he might need a second injection to treat this cord to get the proximal interphalangeal joint straight. But I think, we'll talk about it in a second, but I think he's done so well that there's probably not a need for that. Again, make a good full fist for me, and then open your hand widely, all the way open, and let's see if we can get you to turn your hand over like this and put it as flat as you can on the there you go. So it's really, does it feel pretty flat to you, like
Yes,
you're getting your whole hand down?
yeah.
Yeah, I think it does.
I can feel the palm on the.
You can feel the palm on
yeah.
the table.
Yeah.
Yeah, and that's great. I mean, I think if we were to measure his contracture at this point, he might have a few degrees of residual MP contracture, but less than 10 degrees at this point, which allows him to get his hand fully flat. And what's I think also very impressive with this technique is that there's very little reaction of scarring or reactive swelling in the palm. And frequently after surgery, unfortunately, we do deal with a lot of swelling, a lot of scar thickening, a lot of scar hardening, which really prolongs the recovery and requires a lot of hand therapy. And I think David had you had a couple of visits with the hand therapists.
Really, no, I didn't have any.
Yeah.
I had
Even
one,
better.
and we were going away for the weekend, so we canceled that one.
Yeah.
And the next one I came to you, and you said there wasn't any need of me going to therapy anymore.
Yeah. So you really had one visit just for the split.
Just the split.
Yeah.
And there was a callus here and a callus here, and they worked right out on their own.
Yeah. Great. And you've been using it for all your normal activities and
everything. Yes.
And you haven't had any.
Haven't had any problem whatsoever.
Yeah. No pain in the palm and no difficulty with it, which to me is really quite dramatic.
Yeah.
I've seen an awful lot of these patients over the years who've had their surgery, and surgery works well, but it's a different recovery period altogether. They're in therapy usually for 4 to 8 weeks, and there's a lot of reactive swelling frequently, and occasionally we have some minor wound problems as they heal in, and these have just been really quite uneventful, provided they have the cord in the palm, and that's the key to this. If they have the disease pattern that's amenable to the Xiaflex treatment, they just do great. And David's as good an example as we have of somebody who's really done beautifully with this technique. So.
And actually no pain.
No pain?
No pain.
No. Good, so give me a good squeeze.
Thank you very much for taking care of me. It's wonderful.
Well, it's my pleasure, and it's been great getting to know you. You've been a great patient.
Good, thank you.